Good afternoon, everyone, and thank you for joining us on the County of Monterey news briefing for this Wednesday. We want to continue to keep the community aware of what is happening with the recovery related to the Moss Landing Vistra power plant fire. We're very pleased to have Rick Encarnacion. He is with our County of Monterey Environmental Health to give us an update on work that they are doing and what is happening there. Rick, thanks very much for joining us.
Thank you, Amelia. Good afternoon, everybody. Rick Encarnacion, Director of Environmental Health, County of Monterey. I'd like to give you a brief update on what we're doing here with the Moss Landing battery incident with Vistra. The U.S. EPA continues to conduct their strict oversight of the cleanup, and that is going on with our coordination. No other updates there, just to let the public know that US EPA is continuing their oversight. Also, with regards to offsite, the County of Monterey is continuing with our community sampling plan. Sampling will actually start on this Thursday. We're working with our state regulatory partners with that to make sure that we have all the right places to go. In the chat, I also included our website, which we're continuously updating. Also, I'm going to put our contact information in case anybody has any complaints or concerns. We still have open lines for that. There's also our GIS map, which we're working on, making sure that we get input from our regulatory stakeholders. We're testing it out. We hope to put that out to the public early next week or late next week or early on the week following that next week. And that information will have our testing information, which is already posted on that webpage, on that page that we have already. But the GIS map will provide a format which will lay it out in map form, so that people could view results as we receive them and as we're getting them. And with that, if there's any questions.
Rick, thank you very much. And yes, if anyone has questions for Rick, you're welcome to ask them or you're welcome to put them in chat. Rick, can you remind people about the community sampling project and program that is going to begin this week? People may recall hearing about it, but they may not know exactly what it is.
Mm-hmm. Yes, thank you, Maya. So the community sampling plan is to get further information, get more information to determine if any, and to create a human health assessment, where we need to get more information on the impact of the incident. And the community sampling plan was carefully thought out with input from, again, our state regulatory partners, CDPH, California Department of Toxic Substance Control, the Office of Environmental Health Human Hazard Assessment, and others, so that we could get information, see if there's any impact to human health, and just to continue to monitor the situation. Information is what will help drive our further actions, and also working with the responsible party to address any issues.
And I think it's important if you can point out that this is additional testing. This isn't the first time sampling has been done.
Right. It is additional sampling. It is well thought out, and we want to get information. It is related to enforcement and oversight. This is an incident that's obviously significant for our community. Myself as an environmental health specialist and working with the health department, we want to do as much as we can to get all the information that we need after the fire. That we're talking about resilience and recovery. So we want to make sure that we have information so that we can act on information and as needed, maybe formulate future actions. So with that, we as environmental health specialists or local health inspectors want to gather information in the community so that we could make determinations on what we can do.
And the information that's going to be gathered here, this additional information, this is going to go into the same map and the same postings that we're already providing. This will be in addition to what people can find on the webpage.
Yes, that's correct. It'll be in addition to what's on the webpage, and you know, it's going to be as it is now, a lot of information. And I just want to emphasize again, it's information that needs to be studied, information that may or may not be related to the incident. You know, we're looking at what's out there in the environment. But obviously what we want to do is ensure that if there are any actions that the responsible party needs to follow up on, that we follow up on as your local health inspectors. There's a question in the chat says, what kind of sampling are we doing? Soil, water, and where? So the map will show where, and that's, again, we're going to hopefully push that out in the next couple of weeks. It will mostly be soil samples, and it'll be for elements and chemicals that may be related to and associated with battery fires.
Thank you. Any other questions for Rick today before we let him go and go on to our next topic? Seeing none, Rick, thank you very much for giving us this brief but important update. The community still really is looking forward to finding out what is happening. And then we look forward to seeing the GIS map next week. Can't wait. I know you've had a lot of work has gone into that.
Yes, yeah. Special thanks to all the people that are working out there. Special thanks to the community for being patient. We know it's a very to be honest, it's a very stressful situation, but I want the public to know and to reassure the public, as the Environmental Health Bureau, as your local health inspectors, we're not going away. We're here to help. We're here to find out information, and we're here to help to follow through.
Rick, thank you very much, and we'll see you soon.
Thank you.
Now, on to our next topic. As part of Mental Health Awareness Month, our behavioral health clinics here in Monterey County are holding a series of open houses, for the community. There'll be information about resources. Staff will be available at the clinics to answer questions. This is a great opportunity to find out what services and resources are available for all of us, people of all ages. We're very pleased to have Melanie Rhodes, who is the Bureau Chief for our Behavioral Health Bureau at the County Health Department, to tell us more about these open houses and how people can participate. Hi, Melanie.
Hi, good afternoon, and thanks for having me today. And as you said, yes, May is Mental Health Awareness Month. And so it's really a time to reflect, to connect, and to inspire hope. And to lift up the voices of communities that have too often been left out of the conversation, and to remind everyone that mental health is essential and support is possible. Mental health is health. And, when we think about health, so often we think about physical health, but it also encompasses our mental well-being as well. So including that in the conversation. Too many individuals in unserved and underserved communities still face real barriers to care across the state, across the nation, and whether it's due to language, stigma, cost, fear in sort of our uncertain world these days, or just a lack of knowledge of what resources are available and what services are available in their communities. So, we're not like sitting idle at this time on that. We're looking at what we can do to help get information out there. And so, change is happening. We are working in partnership to serve our community. Behavioral health has a role as the specialty mental health provider in the community. We partner, within and across systems to best serve our community, because we believe that mental health care should be accessible to everyone, regardless of income or background or zip code. And so we are working within and across systems, within healthcare, within education, within housing, within the justice system, and more to truly work on creating a more connected and responsive pathways to care for folks that can meet their needs. So we are really proud to partner with a wide array of community partners and other service providers. And so we together are able to work on expanding access, reaching people in new ways, connecting, building trust across our communities. And this work is only possible through collaboration. There's so much need. Behavioral health alone in last fiscal year, 23-24, served over 13,000 people in our specialty mental health system of care. And so, and that's just like our part of the work. That's not including our managed care plan partners and others in the private sector. So there's a lot of need out there. And so, it's only through working together and in collaboration that we're, able to work in alignment of our efforts and that we can truly multiply our impact and being able to make a difference in this area and bring hope to those who are most in need of it. And so today we invite everybody to be a part of our shared mission and part of the conversation. And this month, especially, and throughout the year, but especially this month, to really shine the light on this and to move forward with purpose and compassion and ensure that mental health care truly reaches every community, every person, every time that it's needed. So in celebration of this month and just increasing overall mental health awareness, we're inviting folks who are interested in learning more about behavioral health resources, as well as other community services and supports, to visit one of our regional access clinics. We have clinics, regional access clinics available in Marina, Salinas, Soledad, and King City. And we've set aside some designated time on certain days throughout the month and different days and dates to really have our staff available to just be there and welcoming the community and to answer questions, provide information on resources and our programs and services and different things. Additionally, in honor of our 1-year anniversary of our LSL Integrated Health Center on North Sanborn Road in Salinas, Behavioral Health will be hosting a more robust resource fair and tabling event on May 21st from 4 to 6 p.m. in the community room over at that location. And we invite folks to come in. We'll have different partners and, providers of services in the community to be on hand as well to answer questions about their program and available resources. And I see those flyers have been dropped into the chat regarding all of this for your reference. And we will also be posting this on our website and getting it out through social media. So we have a few other flyers with just some really important numbers that we always try to push out in terms of, if folks are in crisis or needing to reach out, some of our 24/7 numbers that are available for support, as well as how to reach out, and reminder about 988, and also, all of the community crisis line and all of that as well. So thanks for having me today, and let me share all this exciting stuff with you.
Thank you so much. And I think this is just a great opportunity to really also demystify what happens at the clinics, because some people think I might need help, but I'm not sure. Should I go? Shouldn't I go? Is it weird if I go? This is a great way to low impact find out if this could be something that could really be helpful.
Right. And oftentimes too, we may have, clients who come, but, maybe their families don't really understand. This is also an opportunity for them to show up to potentially their clinic and bring their families so they can see sort of all the resources and things that are available that they're engaging in. And yeah, like you said, very low barrier. If anybody has any curiosity about behavioral health services or anything, and, lots of informational material will be available as well, as well as our staff, just to, have a conversation.
And congratulations also on the 1 year anniversary out at North Sanborn. That was really a monumental achievement to get that facility open. And I'm wondering if you could just talk a little bit about what it has done in terms of providing easy access service in a large community.
Sure. It's really been that opportunity for us as an integrated clinic to have that integrated clinic where we have clinic services available on site as well as behavioral health services. And predominantly we have our children and youth services based out of that location, but all of our locations, have that access component to it so folks can walk in and speak to somebody and get sort of triaged or whatever for any issues that are coming up and like pointed in the right direction, right, and connected to the services, appropriate services that they need. So having it there in the community, we have a great community room there as well, and which we're going to be using for this event. I know over there we also have it's one of the sites for food distribution in the community, so we're really wanting to embrace that idea of it being sort of that welcoming space where folks can come and access services, whether that's behavioral health or other services.
And if you could tell us when these, the flyers are in the chat, but I'm not sure if anyone has the ability to share them on the screen. When are these open houses beginning?
Sure, they're starting next week, and I'm going to ask my counterpart Sandra if she wouldn't mind sharing the ones, sharing screen and showing that right now. Yes, they're starting next week. We're going to be having then next week, I believe, what is it, the 14th and the 15th at different locations. Oops.
Well, we know they're on Zoom.
Sorry about that. Yeah, it's let me bring it up here. So we have, oh, there we go. So we have one on the 14th of May, and that's on Gavilan Drive in Soledad. One on the 15th, and that's here in Salinas over on Constitution. And let's see, we have one on the 21st of May, 1 to 3 over in Marina. And one on the 28th, I believe it is, in King City.
So all those dates are wrong.
Yeah, I'm
there.
gonna have to.
15th, so
Yeah.
showing the correct flyer. So we will get those to you, Maya. If yeah, and we'll get
It happens.
Yeah.
But so we know that they're coming up. So people should watch for social media, watch for the announcements, because we know that we'll be sharing them on our social, we'll be sharing with the communities, that's happening there. We know like Soledad just has an amazing social media outreach too. So we know we'll get that all out there, and we hope everyone will watch for those dates and then come and stop by and have a conversation and relax and find out what opportunities there are.
Yeah, and actually at our event that's going to be happening on the 21st from 4 to 6 at the Alisal Integrated Health Center, they are going to be also helping folks, practice breathing exercises just to sort of calm and ground and be fully present there. So yes, it is May 14th in Soledad from 1 to 3, May 15th in Salinas at our Access Clinic on the campus of Natividad Hospital there in Building 400 from 1 to 3. May 21st, we have 2 events. So there will be the 1 to 3 Regional Access Clinic in Marina. We'll be having that event there, and then from 4 to 6 we'll be having the larger resource and tabling event over at the Integrated Health Clinic on Sanborn, and then in King City on May 28th from 1 to 3. And we will I'm looking at the correct flyer on my screen right now, so we will share those with you.
Thank you. And I'll come for the breathing alone. That's I tell you that if people don't know, it may seem like such a small thing, but to have somebody show you how to relax is a gift. So Come for the refreshments and breathing.
Exactly.
Thank you, Melanie, very much for being here, and we look forward to all these open houses.
Great. Thank you so much.
And now from open houses to community workshops, our transportation agency for Monterey County is hosting a series of community workshops to hear from residents about how to make streets safer, streets and roads safer. This is a great opportunity for everybody to provide their input. We're very pleased to have Amelia Conlen, who's a senior transportation planner for TAMC, here to talk about it. Hi, Amelia. Thanks for being here.
Hello, thank you so much for having me. Let me go into presentation mode here. Can you guys see my screen okay?
We can.
Great. So, as you said, my name is Amelia Conlen. I'm a transportation planner with the Transportation Agency for Monterey County, or TAMC. And there are two projects that I'm here to talk to you about today. And the first is the Monterey County Regional Vision Zero Action Plan. And this is a plan that we're working on that is geared towards eliminating severe injuries and fatalities on Monterey County roadways. We do, unfortunately, on average, have someone who is seriously injured or killed nearly every day on our roadways. And so that's what we are aiming to address with this plan. And the plan will identify the areas with the highest safety needs in Monterey County, and it will also identify recommendations to improve safety on our roadways. And TAMC is partnering with 9 cities in Monterey County, as well as the County of Monterey, on this plan. And so we would love to hear from members of the public about safety concerns that you would like to see addressed in this plan. And there are 2 ways for folks to provide input. The first is to attend one of our community workshops that are coming up over the next 3 weeks. And those are listed here on the screen, as well as on our website. And you can scan the QR code or visit the link to find those. And these workshops are open to anyone who lives in Monterey County. And you are welcome to share safety issues at the workshops for any area of the county. So people who live in unincorporated areas of the county outside of these cities are still welcome to attend and share their feedback. And you can also visit our website to take a survey or make a comment on an interactive map to share areas where you have safety concerns that you would like to see addressed in the plan. And I'll put the links in the chat here in just a moment. And the second project that I want to share with you all is a community election that we are having as part of our North Monterey County Safe Routes to Schools plan. And TAMC is providing $1 million to build projects that improve safety near schools in North Monterey County. And that includes Pajaro, Las Lomas, Prunedale, Castroville, and other unincorporated areas. And the election is going for just a few more days through May 10th. And you can scan the QR code here or visit our website to learn more about the projects on the ballot and vote. And anyone who lives in North Monterey County, who works in North Monterey County, or has kids in school in North Monterey County, if you're over the age of 12, is welcome to cast your vote. And we're working with a steering committee made up of community members in North County who have been designing this process, and we will be announcing the winning projects this summer. So that is it for me, and thank you so much for the opportunity.
Well, these are fantastic projects, and it's really a great opportunity. If people have not had the opportunity to provide input on a project, they don't know what they're missing, because you can drive along the roads and you can say somebody should do something, but now you have the chance to say what that somebody should be doing, right?
That's right. Yes. Yeah, and we do hear safety concerns from community members throughout the county. And so this is a way to pull all of that input together and really identify the areas with the most traffic collisions in Monterey County and identify some solutions. And having the Vision Zero plan in place helps the county, helps our cities secure grant funding in the future to actually construct these safety improvements. So that's what we're aiming to do with this plan.
So as a reminder to people, there are 3 ways to participate in the Vision Zero, the Zero Vision, which wouldn't it be great to have days where you had no dangerous or serious impact to somebody on the roadways, wouldn't it be great to have one day when nothing happened? They can go to the workshops, they can go online and leave a comment, and then they can take the survey. So those are 3 ways, and that's county-wide, not just North County, but throughout the county.
That's correct. Yeah. So I just put the link to the Vision Zero plan in the chat, and I'll put the link to the North Monterey County election as well.
And then be sure to send me your slides, because we want to post them in the, when we post this online, we want to post those slides for everyone as well. Is there a deadline? Remind me if there's a deadline for the county-wide polling, because you've got this quite a lot of community workshops coming up. When are people going to see the outcome of all of this input?
This is our first phase of outreach happening this spring, and we will be doing another phase of outreach in the fall where we will be sharing back the recommendations that come out of the input that we receive. So in August, September, you can expect more community workshops where we share the draft recommendations and ask for feedback from the community. And people are welcome to go to our website and make a comment through June. And we will be taking all of that input and using that to develop our list of draft recommendations.
Fantastic. We hope everybody takes advantage of this opportunity to really make a difference and, share their concerns and what really matters to them. We all want to be safe when we drive. We all want to get there alive, right? Isn't that something that some of our law enforcement people say, arrive alive? That would be nice.
That is our goal with this plan, that everyone gets home safely.
Thank you so much, Amelia, for sharing this. We really look forward to seeing the outcome and all the good responses that people have.
Thank you so much.
And thanks everyone for joining us on the news briefing this week. Our next briefing is next week. We'll see you then.